Hi, I'm Greg.
Hi, I'm Mackenzie.
If you're like most healthcare marketers, you're under constant pressure to drive patient volume and prove ROI to your CEO. In order to drive volume, you need to be able to understand and influence patient behavior. And to influence patient behavior, you need to know the experience they go through to become a patient of your health system. We're here today to talk about patient journey mapping. At Franklin Street, we use patient journey mapping to understand the steps that a patient goes through, both before and after treatment, how they become a patient, and what their considerations are. And we use these steps to identify meaningful interactions and trackable interactions that can be used to attribute ROI to our campaigns.
So at Franklin Street, we've identified 5 constants that are true in a patient journey map regardless of service line. So I'll walk you through those. First, we have a trigger. So this is going to be a life event. It's going to be anything from finding out that you're pregnant to getting in an accident. Next, we move on to planning. That's the research phase. That's when somebody's starting to look at your health system, trying to get more information. Then we'll move on to engagement. That's when someone starts taking action. It's when they raise their hand and say, hey, I'm really interested in finding out more about your services. Then we get to commitment. That's when people receive services. So that's when people make it real and become an actual patient. And then lastly, we have experience evaluation, which is the most important because it gives you information about your health system and how the community views you. And also it spans weeks, months, years. So that's really great. It gives you lots of great information.
So within these 5 constants, for every service line and really for every individual patient, there are a number of variables that will need to be understood. And some of these are trackable, some of them are not. But as you go into understanding and planning a campaign for a service line, mapping those out, seeing where the opportunities are to influence a patient and where there's actual trackable, attributable data is going to be vital. So if we walk through these, trigger, you may not be there at the moment, you probably won't be there at the moment someone finds out that they need surgery, that they are pregnant. But there is data at this stage that really represents this initial trigger point that you can leverage. Physician referrals, your market share, your demographics, what your payer mix is for a service line or your hospital. You can look at that, you can better understand where people are coming from to get started down that journey.
And then next, again, we'll move into planning. Again, the research that people will be doing on your health system. You can look at it'll be websites, digital campaigns, social media, some information from friends and family, word of mouth, and also checking to see if your provider's in network with your insurance. So several of these you can track. You've got your website, and on your website, you can track organic traffic and also the key sites. For the digital campaigns, you can track things like click-through rate and impressions. And then for social media, you can track things like shares and likes. And all of these things can be integrated into a dashboard for up-to-date information.
As we look at engagement, again, this is the stage where people are proactively engaging with your brand on a deeper level. They're showing some interest, and so it's one of the areas where marketing departments have so much opportunity to shape what that experience can be and create a positive experience. This can take the shape of a seminar on-site at your hospital or a physician's office, an online webinar, opting in for an email campaign or downloadable content, or even calling your call center to get initial information or speak to someone over the phone. There's information throughout this stage. All of this should be trackable. How you set it up for a given service line and where you're able to retrieve that data from is what you need to determine before your campaign begins.
And then moving from engagement into commitments, again, this is when people make it real, when they become an actual patient. And you can track these things and see them in things like appointments and visits, in the operations, surgery, and procedure, and when patients enter a treatment program. And so again, these will vary by service line. But as Greg said, in engagement, they are also trackable in commitments. So a really cool thing is that you can see a trickle-down effect from engagement to see how positive that was moving into commitment and making it real.
Finally, experience evaluation is where you get that indication of how good an experience did you create for a patient throughout their journey. So this can take the shape of whether or not they seek future or ongoing treatment from your health system, whether they go somewhere else. Sharing advocacy, so this can be through social media, this can be through word of mouth, donations. If you're a not-for-profit hospital, this is the lifeblood of your health system. So being able to see where donor volume is going, whether it's up, whether it's down, these are all points that are trackable to some degree. You will see this show up. And so really keeping your finger on that pulse and creating avenues for patients to give you more feedback. Surveys, follow-up calls, either immediately after treatment, several months, a year out, lets you understand what kind of experience you're building and then apply that to the earlier stages of the experience. So as we look at patient journey mapping as a whole, it's a very powerful tool at the beginning of a campaign to evaluate the service line experience you're creating, the marketing experience you're creating for a potential patient. Identify the gaps in your system, identify the real opportunities where you can create engagement and drive someone through the rest of the experience in a really meaningful way. The variables through each constant, it's very critical to focus on those key, that 20% of the variables that are going to drive 80% of your volume, 80% of the value for your campaign, and really focus on those, hone those down. And then finally, as you look at your variables, think about your tracking. What can you track? What can you attribute so you can communicate ROI back to your CEO, so you can communicate the value of what marketing does, what the campaigns you bring to the market are, and really stand out. So we thank you. We hope you will use patient journey mapping as you plan your next service line campaign. And thank you for joining us.
Thank you.